Maybe you have appendicitis.
What is that?
It's where your appendix is inflamed and it could possibly explode, which causes infection, and then you'd have to get it removed. So I think we should go see the doctor and find out what it really is.
Mom, am I gonna die?
You could. Don't worry. Dr. Mary Kate, my daughter isn't feeling well and she wants to know what's wrong with her. We think she might have appendicitis.
My right side really hurts.
That's definitely a sure sign of appendicitis. Appendicitis is an inflammation of the appendix, a 3.5-inch long tube of tissue that extends from the large intestine. No one is absolutely certain what the function is. It's a, we can live without it, but there won't be any consequences if we do have to take it out. It's a medical emergency that prompts surgery to remove the appendix, and if it goes untreated, the inflamed appendix will burst, and it will actually leak into your system and cause sepsis, which would not be good. We would have to keep you in the hospital for a few days to give you antibiotics to clean out the infection and everything. It's a long, drawn-out process, so I think it's best that we take care of it now while it's not bursting. And
How soon is the surgery?
we could do it within a few hours.
Okay. How do I know for sure if I have appendicitis?
What we're going to do, we're going to have to give you an ultrasound, and by then we'll be able to tell, if your appendix is actually bursting. And then we will prepare you for surgery, and we will do the procedure on you. And it should probably only take you half an hour, so we should have you in and out of here.
Okay.
How long will she have to stay in the hospital?
Probably about overnight. We'll just keep an eye on her.
Good, because I have prom next week.
Okay, so from your ultrasound, we found that you have a very low white blood cell count, which actually means that you do have appendicitis, and we're going to have to operate very soon. Or else your appendix is going to burst, and it's going to be a longer time period of hospitalization.
So my appendix is inflamed.
Yes. Hi, Dr. Lim and Dr. Canali. I actually have a patient here right now. Her appendix is inflamed, and it's probably going to burst within a few hours. And if we don't do something about it quickly, she's going to be hospitalized for a very long time with sepsis. Okay, so I figured we could perform a procedure where we would go through her mouth, then we would go down through her esophagus, and go through her intestines and whatnot to get to the appendix, cut it out, shrink it, come back out. It's a dangerous procedure, but I think we could do it.
Well, depends. How much time do we have?
Half an hour.
Looks like we have no other options then.
I have found a machine where we can shrink ourselves and go in through the mouth and go in and cut our appendix out. Although it's dangerous, it's the most effective way to do it.
This is some cutting edge technology.
How's that even possible?
I don't know.
Oh my gosh, we're shrinking! Oh no!
Oh my gosh, look how small we are. This is crazy.
Exactly how small are we? Do you know?
Very tiny.
Oh.
Tiny enough to get in our body.
Okay, let's focus. Okay, I think... Oh, there's the mouth. Okay. Oh, okay, quickly go in. She's about to close her teeth in. And I think I see the tongue. Ew, we're going through the saliva. Ugh. Okay. Hey, nice and slow, okay? Oh man, it's really dark in here.
Hey, is the esophagus supposed to have rings?
Wait, no. Wait a second. Where are we? It's like, oh no, this is trachea. We should be esophagus. Okay, well, let's just go through like just the lungs, and then try to get out from like the arteries that are getting out, and try to reach from there to the large intestine. Hopefully we'll get there.
Okay, I think we're entering the stomach right now.
Ooh, well, what's all that green stuff, do you know?
It's all the gastric juices. That's what it used to break down food.
Ooh, go a little bit faster. I think she doesn't have much time left.
Okay.
Okay, I think I see the exit. Let's see, we're going through right now the small intestine, I believe. It's gonna be really long, so can you go a little bit faster?
Okay.
We're losing her.
Okay.
Okay, I think we're starting to reach the large intestine. The entrance is starting to get a little bit bigger. Okay. Where's the appendix? Where it's a little small little thing. And again, we're kind of small, so I think it'd be kind of huge and sticking out. Wait, I think I see it. Wait, stop right there. Okay, and cut it off.
Oh my god, look at how plain this appendix is. Thank God we got here just in time to cut it out. Okay, now all we have to do is flush her system with salt water so that no infection is left in there.
Okay, got that. And a little bit more over there. Got it.
Okay, now all we gotta do is drain everything out, and then we're finished.
Okay, let's get out of here.
Gosh, we gotta hurry because we only have a few more minutes before the shrinking wears off, or else we'll have her burst.
Oh, okay. Try to go carefully, but go extremely fast. Okay, we're going through the large intestine's over. Now we're going through the small intestine. Okay, now the stomach, the esophagus, now the mouth. Yes, and now we're out.
Yay.
Feeling a little better, actually.
Good. Yeah.
Can I get out of here today?
Not today. We need to keep you for a few days just to make sure everything's alright and your insides are cleaning out well. And then you should be good.
Okay, so the way the procedure is going to start is that we're going to start from the mouth, and then from the mouth we're going to go through the esophagus, and then from the esophagus we're going to go to the stomach, and from the stomach we're going to go to the small intestine, very long maze, and then from the small intestine we're going to reach into the large intestine, and then eventually we're going to go to the appendix. And that's what we're going to cut out, and then after we get that and clean out your insides, then we're going to get out from the way from back where we came in.
Removal of the appendix, called appendectomy, is performed when appendicitis is suspected. Right lower abdominal pain, fever, and elevated white blood cell count are common symptoms and signs of appendicitis, which usually occurs when a blockage develops between the appendix and the intestine. This leads to infection, swelling, and distension. If the appendix is not removed, it can lead to a life-threatening perforation or rupture. The only treatment for appendicitis is appendectomy, which is almost always performed on an emergency basis. Newer laparoscopic techniques require only tiny keyhole incisions or puncture wounds, which generally result in a shorter recovery period. An uncomplicated laparoscopic appendectomy usually takes between 20 and 30 minutes. To gain access to your appendix, your surgeon will use sharp instruments called trocars to create 3 small holes or ports through your abdominal wall. These ports are usually located at your navel or umbilicus and in the upper right and lower left quadrants of your abdomen. Carbon dioxide gas will then be pumped through the umbilical port to puff up your abdomen. Images from its camera are projected onto a video monitor in the operating room. Your surgeon will carefully examine the inside of your abdomen, confirming that your appendix is red, swollen, and needs removal. At this point, your surgeon will pass surgical instruments through the other 2 ports, grasp the appendix, separate it from the intestine, drop it into a specimen bag, and remove the specimen bag through one of the ports. After your appendix has been safely removed, your surgeon will instill warm, sterile salt water through one of the ports into the abdomen to cleanse the abdominal cavity and remove any traces of infection. The salt water is then suctioned out. Before removing the laparoscope, your surgeon will take one final look around for areas of bleeding or other damage. When the laparoscope is removed, a port valve is left in place briefly to allow all the carbon dioxide to escape from the abdomen. Finally, the keyhole incisions are closed with sutures or staples and covered with bandages.